Hi, my name is Julie and I'm a massage therapist here at Zazen Spa. Today we're going to give you a brief demonstration of what craniosacral massage therapy is like and what are our goals during a craniosacral therapy massage session. Okay, we're going to begin the session. Our main goals in the session are to find and release compressions or restrictions in the craniosacral rhythm. The craniosacral system has a rhythm, much like the respiratory and circulatory systems have rhythms. We begin by feeling on the client different spots on the body where we can just feel for the rhythm and get a sense of where there might be compressions or restrictions in the rhythm to see where the client is at before we begin. Alright, I'm still feeling at different places for the rhythm to see if it's stronger on one side than the other, or generally weak, or just the quality and characteristics of the craniosacral rhythm. Okay, now we're going to begin the session after we've done the listening to get an idea of what the rhythm is like. We begin on the client's torso to release tightness and restrictions around the spine and in the torso, and then we will do releases on the head.
So you go under the sheet?
Mm-hmm. The client should always dress very comfortably, as the clothes will remain on.
Julie, if there's constrictions in this area, what kind of pain or dysfunction could somebody have?
Well, we're releasing restrictions around the sacrum and the hip area. So you might feel discomfort in your very low back, or in, through the back of your hips in this area. Now we're doing the release higher up on the torso. If things are tight and restricted in this area, obviously it affects your nervous system, because all the nerves coming out of your spine and going to your organs are affected.
And Julie, you're going faster than normal. This is just, you're just getting an example.
Right.
Normally,
I'm just demonstrating. These releases would take longer. We're just giving you an idea of what the holds look like and where they're at. Now I'm doing a release on the hyoid bone on the throat. Alright, now we're going to start by compressing the fourth ventricle. This is an area in the brain near the brain stem, and doing this release causes a state of deep relaxation, and it's a good way to start the session. After that, we'll do an occiput release. This is right at the base of your skull, and it's a very good thing to help people that have headaches or have been in car accidents and have whiplash. It helps to release the tension at the base of the skull. The frontal bone release is very good for people that have issues with worrying and overthinking, especially at nighttime.
no, that happens to people?
Yeah, it does. The parietal bone release is very good for people who have seasonal affective disorder and depression. Do a temporal bone release. This releases the temporal bones here that are near your ears. This is good for the temporomandibular joint dysfunction problems. Then we'll do a mandible release. Also, this release is good for the temporomandibular joint for people with the jaw problems. Then we do a release here at a bone called the sphenoid. This bone is down in the middle of your skull, and most of the other bones in the skull touch this bone. So this is what we call a master bone. It affects a lot of other things. release for the zygoma bone. This bone will also affect a temporomandibular joint function. And then one for the ethmoid bone, which is deep down under your nose. This will affect your sinuses, so if you have sinus issues, this is good for that. All right, we're going to end with the sacrum. I'm going to put my hand under her sacrum at the bottom of the spine, and this release, the sacrum affects, getting a release on this bone can affect if you have spiritual issues. This bone tends to help with that, and of course sacroiliac joint dysfunction, which is the joint where your sacrum, the triangle-shaped bone at the bottom of your spine, connects into your hip. So I'm going to put my other hand in, and I'm going to pull, create a space in between the sacrum and the lumbar vertebrae. And I'm going to do a release here to kind of pull the iliac bone in the hip away from the sacrum to create space and align the joint there.
Here.
This therapy, as you can see, is a very gentle and light touch, not invasive. Because you are fully clothed, a lot of people are more comfortable with this than with some other kinds of massage therapy, and it can be a very effective therapy when other therapies have not worked for you.
All right, so how was that experience for you with the cranial sacral therapy?
Well, it was very different from a traditional massage. It was really gentle, and it was very relaxing, but it was different in that I felt like I was relaxing from the inside out.
Really?
And,
That's interesting.
Yeah, and I can especially feel it in my face and in my jaw, you know, where she worked. And as the massage progressed, that I could sense more when things were releasing.
All right.
So
All right.
yeah, it was great. I'm interested to see how I feel in an hour.
Yeah, great. Thank you so much.
Sure, thank you.